Hello guys, and welcome back to my channel. So if you're seeing me for the very first time, hi, my name is Sam. I am a registered nurse, a singer, songwriter, and a potential novelist. So in today's video, we will be going through the NMC practice questions provided by Pearson Vue. So I'll be taking you guys through the practice questions and trying as much as possible to explain them. So if this sounds like something you are interested in, please make sure to like, comment, and subscribe. Without any more delay, let us dive right into it, guys. So to access it yourself, all you just have to do is to put into Google NMC practice questions Pearson Vue, and this would come up. So you can just click on it, and yeah, you can read this to be, the instruction says here for example, if the correct answer to a question is 5 ml, then the following responses would be marked as incorrect. 5 ml of water, 5 milliliters, 5 mils, 5 ml. So it should be 5 ml just as it's written. So sometimes it's not that you are not getting it correctly, but you are just writing the answers the wrong way. Okay, so once you've read it all, just go ahead and you will see if you're to choose nursing or midwifery, you go ahead and choose nursing because that's what we're doing right now. And then which branch of nursing are we doing right now? So we are doing that for adult nursing. We'll be doing numeracy. Okay, again, please make sure to read all the instructions before you go. I think the numeracy is for 30 minutes. Yeah, it's there. So once you've read the instruction, of course, you go ahead, select yes. So what is the volume that has been drawn up into the syringe? Please use the correct unit and write your answer to 1 decimal place. Always take note of the instruction. So this is 6.5. Now we have not been given a unit, so we're going to write it ourselves. What is the volume that has been dispensed? Please use the correct unit. 20 ml. A patient has been prescribed 2 liters of 0.9 sodium chloride. What is the volume in milliliters? That is 2000. Oh, you see, I just made a mistake. Now, all I just had to do was 2000 and needed not to put the ml because it's already there in your answer. So thankfully, it did not allow us to put in that. If not, the answer would have been wrong. A patient has been prescribed 0.6 gram of ibuprofen. What is the dose in milligram? That is 600. Again, gosh. A patient has been prescribed 300 milligram of phentoin. How many tablets should be administered? Now, you can see on the packet that it says 100 milligram tablets. That means 1 tablet is 100 milligram, and your patient has been prescribed 300 milligrams. So what do you have to do? 300 divided by 100, which gives you 3. If you do not understand how I was getting some of the answers, please do make sure to leave your questions in the comment section and I will answer them, okay? A patient has been prescribed 1 gram of carbocysteine solution. I think carbocysteine is for, I can't really remember what it's for, but we use it here. Let me just search quickly. What is carbocysteine prescribed for? Yes, it is prescribed for treating and preventing respiratory diseases associated with thick mucus. So people with pulmonary diseases such as COPD and all, or people that generally produce thick mucus, they are prescribed carbocysteine and it helps them get better. So 1 gram of carbocysteine is prescribed, and we have 200 milligram per 5 ml. So in order to get 1 gram, we need to get, that's 200 milligram into 1000 milligram. That's how many 200 milligram is in 1000 milligram, which is 5. So we are going to give how many mil? So I don't want this video to be too long, so that's why it seems like I'm a bit, these are basic mathematics. So we have 200 milligram in 5 ml. That means we have 1000 milligram in x. And what is the answer if you cross multiply and everything? Our answer should be 25. So 25 ml. Take note of how I'm putting the units, ml, just like it's written in the question. So a patient has been prescribed 100 milligram of phentoin suspension. What volume should be administered? Please use the correct unit. okay, a patient is prescribed 100 milligram and our bottle comes in 250 milligram in 5 ml. So that means 1 ml is 50 milligram. You know how I got that, right? Divide both sides by 5. And then since 50 milligram is equal to 1 ml, so how many milligrams will give us, how many mils will give us 100 milligram? That, since we have 50 milligram in 1 ml, 50 times 2 will give us 100. So we are going to give 2 ml. I hope you understand. A patient has been prescribed levetiracetam suspension. It is something that is used for seizures, people that have seizures. A patient has been prescribed levetiracetam suspension at a dose of 10 milligram per kg. So this person weighs 70 kilograms. What volume should be administered? That means the person is having 10 milligram per kg. That's 10 times 70, which gives us 700 milligram. So this suspension comes in 100 milligram per 1 meal, and we have to give the patient per kilogram, which gives us 700 milligram. So how many mil are we given? It's simply 1 times 7, which is 7 milliliters. A patient has been prescribed 60 milligram of flupentazole decanoate. What should be drawn up for the syringe? Please use the correct drainage. So this is very simple and straightforward. 20 milligram is in 1 ml and we have to give 60 milligrams. So that means 20 divided by 60, which is 3. A patient has been prescribed 4 milligram of diamorphine hydrochloride. These are like medications for end of life, people that are dying. So like just to make them, we have medications to make them pain free, we have medications to get rid of their excess secretions, we have medications to sort of relieve them of agitation and all sorts of things. So a patient has been prescribed 4 milligram of diamorphine. What volume should be drawn up for the syringe? And we have 5 milligram in 1 ml. Now this one is a bit tricky. You know what, let's just do it like a maths calculation. Since 5 milligram is in 1 ml, how many milligram will be in 4 ml? Do it, cross multiply and tell me your answer. Okay guys, so my answer is 0.8 mil using that method that I told you guys to do. I think there will be calculators on your computer, because you'll be using your computers, of course, so you have nothing to worry about. And your answer already says in 1 decimal place, so that should give you, your instruction says in 1 decimal place, that should give you like a sort of like nodding, like, okay, oh, this thing is going to be in a decimal answer. A patient has been prescribed pethidine hydrochloride at a dose of 0.5 milligram per kilograms. Your patient weighs 90 kilograms. So that means this person is already due for 45 milligram. So what volume should be drawn up for the syringe? So this person is to take 45 milligram and it gives us 50 milligram in 1 ml. And the person is to take 45 milligram. So let's use the same method again to calculate it. 45 divided by 50, 0.9 mil. I hope you understand this, guys. I really do hope you understand. So what I did was this times this, it gave me 45. Then I brought this here. So 45 milligram is equal to x times 50, 45 times 1, divide 45 by 50, and that's how I got this. I really do hope you guys understand, but if you don't understand, I may have to offer a master class for this. It will be very affordable, but I really do hope that you guys understand, because I'm not doing this because I want to make money from a master class. I just want to help you guys to be able to learn these things by yourself without much stress. So the next question says, at what rate should you set the infusion pump to run? Okay, so we are to set up an infusion of 400 ml to run for 5 hours, and it's starting by 8. So all you just have to do is 400 divided by 5, because the time is asking like how many ml per hour. 400 divided by 5 gives you 80, so that's 80 ml. I don't think you need up to 30 minutes to finish this part, to be honest. So the same thing goes for this again, 1000 ml in 6 hours. At what rate should you set the infusion pump to run? Give your answer to the nearest whole number. 1000 ml, you've got 1000 ml to run for 6 hours. Let me do the proper calculation. That will be 1000 divided by 6. Okay, 16.67. All right, so your calculator would just be somewhere like this, 0.67. So give your answer to the nearest whole number. So that will be 167. Another question says this is a blood, 800 ml, and to give for 5 hours. So how many ml per hour would you run? That's 800 divided by 5. So 800 divided by 5. Okay, 160. Now we have gotten to the most tricky part. Okay, so all you have to do here is to fill up this. Now note that anything that is input is plus, anything that is output is a deduction. So what we have to do now is to add up all this input. So let's get our calculator. How many 125 do we have? 125 times 6 plus 150 is 300 plus 100. Everything gives us 500 plus 500. That's 1250. So total input is 1250 ml. Because if you read the instruction, it says if the patient has gained, so total output equals 910 ml. So we are going to subtract this from each other. So our final answer, don't forget the person gained, so it will be plus, what was that again? 340. I can't remember if there's supposed to be plus or minus in this total and total input and output, but let's just see, guys. We got everything, so you guys can see that it is very easy, honestly. The first question says, what is the volume that has been drawn up into the syringe? Please use the correct units and write your answer to 1 decimal place. Again, instructions are a very big thing. Now you can see that over here we have 1.5, which means this is 1.6, this is 1.7, and this is 1.8 ml. So we're just going to scroll down and write our answer, 1.8 ml. Now there's no ml here, so we are permitted to put it. Now next, what is the volume that has been dispensed? Please use the correct units. This is already given to us. It says 10, so we're just gonna go ahead and put 10 ml. You can see how I'm putting my ml just like it's written on the dispensing pots that we're seeing in the picture. Next, a patient has been prescribed 0.2 milligram of digoxin. What is the dose in microgram? Now, how many milligram make micrograms? I think that is 1 milligram is equal to 1000 micrograms. 1 milligram equals 1000 micrograms. So that basically 200 micrograms. Because you already have a unit, you don't need to put your micrograms in there. A patient produces 1250 ml of urine in 24 hours. How many is that in liters? That is 1.25. Anyway, I'm just gonna flag the ones that I'm not too sure of for a review later. So a patient has been prescribed 800 milligram of aspirin. How many tablets should be administered? And each tablet is 200 milligram. So that's basically 800 divided by 200, which is 4. A patient has been prescribed 100 milligram of amitriptyline hydrochloride solution. What volume should be administered? Please use the correct units. Now we have 25 milligram in 5 ml. That means 5 milligram equals 1 ml. So since 5 milligram equals 1 ml, how many milligram will be 100? So it's basically just calculation. You just go ahead and calculate it. Okay, so let's just do it like this in order to save our time. 25 milligram equals 5 ml. 100 milligram then equals how many ml? That's x. So how many 25 will be found in 100? That is 4. So 4 times 5, which is 20. So our answer is 20 ml. A patient has been prescribed 600 milligram of cefadroxil suspension. What volume should be administered? Please use the correct units. Again, 600 milligram of what volume should be administered. Now 250 milligram equals 5 mils, so which means 50 milligram is 1 mil. I hope you understand how I got that. Divide every area by 5. So basically, 250 milligram equals 5 mil, 600 milligram equals X. You just divide both sides and your final answer should be 12, making 12 mil. So that's how you should basically do it all in order to get your answer. I hope you understand all of this. So I won't have to go this deep in other questions. Again, take note of your time so that you don't waste too much time on a singular question. Now, a patient has been prescribed phenytoin solution at a dose of 1.8 milligram per kilogram, and the patient weighs 100 kilogram. What volume should be administered? So that is 100 times 1.8, which gives us what? 180 milligram. So how many 30 can be found in 180 milligram? That is 6. So 6 times 5, because 30 milligram is 5 mil, right? So that's 6 times 5 gives you what? 30 L. A patient has been prescribed 36 milligram of codeine phosphate. What volume should be drawn up for the injection? Please use the correct units and write your answer to 1 decimal place. So we know this one is in 1 decimal place. Again, we're going to use the same method that we used earlier for the previous questions. Now, do not be scared and think, oh, I won't have a calculator or something. No, don't worry, you will be given all of that. It's a computer stuff anyway, so there's calculator available in your computer, okay? And I think you will be given like a sheet of paper or something, or you can ask for it, and a pencil as well. So let's go ahead and answer this question. Okay, so 36 milligram is what we are given, and we have 60 milligram in 1 mil, and this equals X. So what we are basically going to do is to divide 36 by 60. So 3 here, 6 here, 6 here, 10. So your answer is 0.6 mil. I hope you understand that. So your answer should be 0.6 mil. Now let's just go ahead and input that in our... A patient has been prescribed 8 milligram of metoclopramide hydrochloride. What volume should be drawn up for the injection? Please use the correct units and write your answer to 1 decimal place. So if 5 milligram equals 1 mil, 8 milligram equals dash. So your answer would be 8 divided by 5, which equals 1.6. Now, I feel like these are like basic calculations, all these parts, and I don't need to go in too deep. Or, I just hope you understand, really. A patient has been prescribed tramadol hydrochloride at a dose of 1.5 milligram per kilogram. Tramadol is for pain relief. Your patient weighs 80 kilogram. What volume should be drawn up for the injection? Now, we are not given like the actual dose this person should take. So the first thing you have to do is multiply 80 kilogram by the dosage, which is 1.5 milligram per kilogram. And that is basically 120. So we have 50 milligram in 1 mil. So if 50 milligram equals 1 mil, 120 milligram equals dash. And that gives us 120 divided by 50. I hope you understand. So what is 120 divided by 50? That is 2.4 mil. At what rate would you set up the infusion pump to run? Now this is basically, flow rate or something, how to set up infusion. Yeah, so this one is basically multiplication. You have or division rather. Let's see, you have 750 mil to run for 6 hours. So basically what you have to do is to carry 750, the volume, and divide it by the hour given. That is 750 divided by 6, which gives you 125 mil per hour. Now in this aspect, you just need to put your 125. You don't need to go deep, because you already have the unit. So let's go to the next question. I don't even know which question are we in now. At what rate would you set up the infusion pump to run? Give your answer to the nearest whole number. Now this one, we have a volume of 700 divided by 8 hours. So what you have to do is again to divide. Calculator, 700. So we have 87.5, and to the nearest whole number we have 88 ml per hour. Again, similar thing, 800 ml divided by 10 hours. We have basically 80 ml per hour. Now, we've come to the bit of interesting part, which is the balancing of fluid chart. This person has had sodium chloride, 500 ml. So what you have to do is to calculate all of the inputs, put it on one side of the total inputs, calculate all of the outputs, put it in the total output, and then when you balance it, if the input is more than the output, then your answer should be in plus. But if the output is more than the input, then your answer should be in minus. It is very simple. So let's just go ahead and do this one as well. I don't know, should we put ml? Yeah, let's put ml. That is output of 505 mil. So balance gives us what? 950 minus 55, which is 445 ml. So we have an input of, again, the instruction is already given how you are supposed to write it. So we have a balance input of plus 45 and we got everything. So you can see that this is very simple, and yeah, you can do this. It's not so difficult. So let's review the flagged ones, the ones that I flagged. Okay, I mean, there's no need to review it. It's because I was doubting anyway. So if you liked it, make sure to give it a thumbs up, comment, like, share, and subscribe. Share to a friend who you know that would need this, and I hope to see you in part 3. Okay, let's go to the first question. What is the volume that has been drawn up into the syringe? Please use the correct units and write your answers to 1 decimal place. This is very straightforward. We have where the fluid is stopped at 0.8. So we're just going to scroll up and put in 0.8 mil. What is the volume that has been dispensed? Please use the correct unit. This is 15 ml. A patient has been prescribed 0.8 liter of gelofusine. What is the volume in mil? We all know that 1000 milliliter is 1 liter. So 0.8 liters times 1000 gives us what? 800 mil. Isn't that too much though? A patient produced 650 ml of urine in 24 hours. What is the volume in liters? That is 0.65 liters. Please take note that where the units have already been provided for me, I am not putting them in at all. A patient has been prescribed 375 mg of vancomycin. How many capsules should be administered? So we have each capsule to be 125 mg. So we're just going to carry 375 and divide it by 125, which I believe should be 3. Yeah. A patient has been prescribed 15 mg of nitrazepam suspension. What volume should be administered? Please use the correct unit. So 2.5 mg is 5 ml, which means that 15 mg will be how many ml? You just sort of do some cross multiplication and arrive at your final answer. So I have done mine and I have arrived at the ml, and I'm just going to put that in right now. A patient has been prescribed 450 mg of ampicillin suspension. What volume should be administered? Please use the correct units. 125 mg equals 5 ml. So how many gives us 450? So again, we just go ahead and do cross multiplications. Now I have done my calculations and I have arrived at 18 ml. Our next question says, a patient has been prescribed erythromycin suspension at a dose of 1.5 mg per kilogram. The patient weighs 100 kilogram. So what you have to do is to multiply 1.5 times 100, and the answer is 150. So how many ml should you give? Since 125 mg equals 5 ml, that means 1 ml equals 25 mg, and we are supposed to give 150 mg. So that means we are given 6 ml. If you don't understand how I came around this, you can just go ahead and do cross multiplication as well. A patient has been prescribed 400 mg of zuclopentazole decanoate. what volume should be drawn up for the injection? Please use the correct units. We have 200 milligram in 1 ml, and we are to give 400 milligrams. So that's basically, 2 of it, times 2. So we're giving 2 ml. A patient has been prescribed 60 milligram of haloperidol decanoate. What volume should be drawn up for the injection? So we are to put our answer in 1 decimal place. And all you have to do is to just go ahead and divide 60 by 100 in this kind of situation. So when we do that, we should have something like 0.6 ml. Next question says, a patient has been prescribed pethidine hydrochloride at a dose of 0.5 milligram per kilogram. The patient weighs 88 kilogram. Now, what volume should be drawn up for the injection? So all you have to do is to multiply 88 kilogram by 0.5, which gives us 44 milligram. Now we have 50 milligram in 1 ml. So just like the previous question, you just go ahead and divide 44 by 50. So our answer says 0.88 ml, and we have here that you are to give your answer in 2 decimal places. So of course we know that it's 0.88 ml. Are you wondering, like, how am I supposed to give 0.88 ml? Yeah, if it's me, I would probably just draw up to 0.9, not up to 0.9 completely, because when you give, a little bit remains in the syringe anyway. Now we have come to the fluid rate charts. So at what rate should you set up the infusion pump to run? Give your answer to the nearest whole number. We have a fluid volume of 800 to run for 6 hours. So basically what we are going to do is to divide 800 by 6, and that should give us 133.33, and the instruction is to give your answer to the nearest whole number. So our answer is 133 ml per hour. Again, take note of your instruction and take note of your units. At what rate would you set the infusion pump to run? 1000 divided by 5. I don't need to calculate that one, it's 200. 200 ml per hour. So we have another one, 300 ml to run for 3 hours. Again, 100 ml per hour. So some of these questions can be very simple, honestly. Now we have the fluid balance chart. So what you have to do is to calculate your input, calculate your output, and then subtract them. If your input is greater than output, then it is plus. If the output is greater than input, then it is minus, which means that the person actually has lost fluid than gaining fluid. So it's as simple as that. I will just go ahead now and add everything up, and I'll put them here. So I have calculated all inputs to be 750 ml and all outputs to be 680 ml, and then I am now going to subtract them from each other, and my answer is 70 ml, and the input is greater than the output, which means that the person gained fluid. So I'm just going to go ahead and put plus 70 ml. Please take note of the spacing, how I'm spacing it, because this exam is going to be marked by computer, not a human being that will know that, oh, you just didn't write it well, how the computer is programmed to mark it. I hope that makes sense. So let's go ahead now and see. Yeah, we got everything. So I hope you understood everything, and that is it with this video. If you enjoyed it, please do make sure to like, comment, and subscribe, and check out the clinical questions practice tests as well that I will probably be uploading very soon or already have uploaded. So until next time, bye.
Don't let the beat whistle, just try to blend into the tune. Don't let the beat whistle, just let your voice flow to the tune. Don't let